we've left this. I don't know if you can see the foramina here, the holes in the coffin bone.
Es gibt Löcher in das Hufbein, wo natürlich die Arter und Venen rauskommen, die von die.
So remember, we've already removed the digital arteries. So the medial and lateral digital arteries come down, branch off several places. One branch to the digital cushion, one branch goes around and outside of the dorsal artery, which is the foramina is not here yet because this wing of the coffin bone is not finished growing, right? And it sends, and then these two arteries go into the hoof, what we call the terminal arch, and then they meet.
So die laterale und mediale palmaren digitalen Arterien und Venen, die geben eine Abzweigung. Das sieht man hier bei den Fohlenhuf nicht, weil Hufbeine haben noch keine entwickelte Palmarprozesse oder Plantarprozesse. Aber dann sieht man hier die Rille, das ist die äußere Arterien und Venen. Und dann gehen die in das Hufbein durch diese Löcher und machen da einen Anastomosis.
They form what we call an anastomosis.
Yes.
That's where two arteries come together. So something has to happen. Otherwise,
there's
no blood flow. So on this terminal arch, there radiate of all of the arteries that perforate the parietal surface of the coffin bone.
So aus diese
radial arteries.
Diesen sind
all these.
Das wäre nicht so gelöchert.
But if you look closely on the bottom,
und es gibt auch
they're very prominent foramina.
Auf die distale Rand sind die kleinen Löcher mehr prominent.
And these send branches out and they connect into fimbria.
Und die schicken kleine Branches aus.
Which is the circumflex artery.
Und die gehen nach die marginalen Arterien.
Yeah. And
you know that we call it the marginal.
Yeah.
And I translate it literally. And you call it the circumflex.
Yeah. Who we're talking about, right?
Yeah. But for the Germans, I have to call it the marginal one. But I was just checking with Alexander.
The one that goes around the legs.
Yes.
Yeah, and remember, that perfuses the soul.
Ja, und der gibt die Blutzugzütken, die weiße Linie formen. Wo Hufbein aufhört, muss etwas die Lamellen, die lebendige Blättchen verplatzen, der Substitut. Und das sind natürlich die weiße Linie-Chorea.
Okay, so we've tried to get all this laminar chorea off. Really, you need a rotary tool to get it.
Und das ist die Sound, die man will, wenn man einen Krebs ausschneidet. Bis dann, wenn es Tschoff Tschoff macht, ist es nicht gut. Wenn man das anfängt zu hören, ist man gut weit vertieft genug. I was just saying, this is the sound you want to hear when you are cutting out hoofkanker.
A hoofkanker, yeah.
You know, till it goes Tschoff Tschoff, it's still bad tissue. When you start hearing this, you are deep enough.
That's the truth. Okay, so let's take out the bottom of the hoof. Let's take yep. Well, first I'm going to take the plantar cushion.
Jetzt macht das Hufkissen raus. Das Strahlchorium.
And what's on here is the frog chorea on the outside. So this is the frog chorea, this thin skin on the outside of this plantar cushion. And I'm already cutting into the cartilage of the ungular cartilages here.
Und hier komme ich auf die innere Haken von dieser Hufknobbel, die in das Hufkissen eingegraben sind.
Right, so this is the plantar cushion.
Das ist das.
And if you want to feel it, you can feel that there is actually this cartilage, the axial projections of the ungular cartilages here.
Und man kann an diese Ecke hier.
Okay, let's take this side of the ungular cartilage off. Now remember, by way of ligaments to the coffin bone, and then extends all the way back to the back of the foot.
So das hintere Teil vom Fuß ist flexibel, weil das show them what a plantar thing. So eigentlich ist einen guten 40% oder 35% von hinteren Bereich ist nicht Knochen.
You can see I will just remove basically the last heel quadrant here internally.
So dieses Schenkelquadrat oder das.
And you can see on the inside is part of the abaxial venous plexus.
In the
A horse's skeleton to fully mature. I have not read anywhere, and maybe someone knows, when the coffin bone fully matures.
Aber ich glaube noch immer nicht, dass das.
Agreement there?
Could be.
Yeah. I don't know if anybody's ever done a proper study on the maturation of the coffin bones, and it would need to be done
On the same horses.
species to species.
Yeah.
It would be in the racing game. Horses are running at their fastest, at their most intense athletic level at 3 years old, before the foot is fully mature. First, I had brought a hoof capsule from a 3-year-old thoroughbred racehorse and compared it to another breed, and you can see that even at 3 years old, and Scott's going to give a talk on this later, I think, about heel pain, to the overstimulation of the digital cushion.
So glaubt, dass dieses
This digital cushion is referred to as myxoid tissue.
das digitale Kissen ist als
Variety of different cells in it, from
es hat verschiedene Zellstrukturen histologisch gesehen.
Collagen fibers,
Es gibt Kollagenfiber,
islands of fibrocartilage,
die verschiedene Gewebe, die es im Hufkissen gibt. Die ist auch die
that when we start, and Scott mentioned this yesterday about when they start putting horses in speed, how the bone changes. My point is that I think that sometimes we overstimulate this myxoid tissue, or this digital cushion, and it crashes, and then it doesn't develop properly, and we see that
in racehorses.
We see it in racehorses because we see it a lot, but racehorses especially, we see this caudal heel pain. And if you look at the capsule, the bars are flattened and everything is flattened out of the bottom of this foot. So of maybe giving a horses another year, and that's changing the big races from 3-year-old to 4-year-old, but that will never happen.
Ja, und später drin, dann gehen die besser mit 5-Jährigen. That's of course also the British perhaps do that more because they are a lot more steeple chase overs.